Well, thank you, Senator McConnell. Where we're at, we're on path to pass Graham, Cassidy, Heller, Johnson. It's not if, it's only a matter of when. I've talked to my colleagues. Everybody's very enthusiastic about the idea of taking money and power out of Washington, returning it to their states to give their constituents more say about their health care. There's universal agreement in our conference that Obamacare is failing, can't be repaired, is structurally flawed. Our Democratic friends are talking about bipartisanship. Let's engage each other and see if we can find a bipartisan pathway forward that basically changes Obamacare, doesn't prop it up. In terms of Alaska, I've learned a lot about Alaska health care. I'll talk to you privately over a drink. Our friends in Alaska, there are 750,000 people in the state of Alaska, twice the size of Texas. We've learned about their unique needs. I found out things about other states I never dreamed of, and here's what I've concluded. With a process that gives more attention and time, we will repeal and replace Obamacare with a block grant called Graham, Cassidy, Heller, Johnson. The missing ingredient for us as Republicans has been, we know what we don't like. Obamacare is not working. We make that case effectively. But we've had a hard time articulating what we're for until now. Now we have something to talk about that makes sense to 50 Republican senators, a lot of governors, and I hope the American people. If you're a single-payer believer, God bless you, I just respectfully disagree. But what we're proposing is the end of single-payer health care in Washington. This is an idea that worked with welfare reform. In 1996, the Congress, in a bipartisan fashion, under Bill Clinton, took the welfare system and block granted it back to the states with guidelines and guardrails and achieved a lot of success in welfare reform. I am convinced that innovation and flexibility is the key to sustainable, affordable, high-quality health care, and that Obamacare is the exact opposite of innovation, flexibility, and high quality. We're down to one provider in my state. In 2014, we had 5, a 31% increase in South Carolina alone. This system is failing, but the good news for America is Republicans are not just going to deliver on a campaign promise. We're actually going to improve your health care by giving you access to people who care more about you at home than any bureaucrat here could in Washington. It's a simple proposition. Taking basically the same amount of money in a fair way, allocate it to the states. You have to spend it on health care, not football stadiums, not roads or bridges. You have flexibility, but there are guardrails. And I believe this with all my heart, that a governor, a state house member is going to listen closer to you and care more about your family when it comes to your health care than some bureaucrat here in Washington who will never know your name. To the leader, thank you. It's complicated, it's difficult politics. Instead of quitting, you allowed us to move forward, and oh my God, how far we've come in such a short period of time. To President Trump, thank you for engaging. To Vice President Pence, you have moved mountains. Governor Pence has shown us that with flexibility, governors with the right attitude can improve quality. It's called Healthy Indiana. So the leadership team has done everything we've asked them. We're coming back to this after taxes. We're going to have time to explain our concept. We'll have a better process, and we're going to take this show on the road. Dr. Cassidy has a heart unlike anybody I've met for reform and an understanding about people when it comes to health care that I could never hope to match. For decades, he worked in a hospital, nonprofit, serving underprivileged people, and he's convinced me that when the patient is the focus of the exercise, the outcomes are better. Dean Heller is in a tough political race. He embraced the idea, give Nevada the money, we can do better if you let us. Ron Johnson has been a guy, Mr. Smith goes to Washington. All I can say about this little team, including Rick Santorum, who sort of started this process, I've been up here 20 years. I've never enjoyed anything more. I believe this is the most important thing I can ever do for the country, working with my colleagues, is not to just repeal Obamacare, but to replace it with a system closer to where you live, controlled by people you can vote for. And we're going to get there. To my Republican colleagues, we're going to fulfill our promise to repeal and replace. To the American people, we're going to improve health care for you, because at the end of the day, that's the only promise that matters.